Welcome to Week 3. You made it. Today's lecture is on Research Designs, a focus on quantitative studies. This is Average Joe. Why did Average Joe get a heart attack? Is it because he's fat? Or that he smokes? Or is obese? That he eats the wrong things? Or is that because his brain is too small? Or that he weighs too much? Researchers conduct epidemiological studies to understand disease causation, describe disease causation, and generate and test hypotheses and evaluation of health interventions. Epidemiological studies can be observational or experimental. In observational studies, the researcher allows nature to take its course, observes existing phenomena, and measures risk factors and outcomes. No intervention is performed. The investigator does not control the study population or the factors to which the study population is exposed. Observational studies can be further divided into two subcategories, descriptive or analytical. A descriptive observational study is when the study is limited to a description of occurrence of disease in a population. This is often the first step in epidemiological intervention. Case reports or case series are an objective report of a clinical characteristic or outcome from a single or multiple cases of disease. This is the weakest type of study reported. However, it is useful in the recognition of description of a new disease and detection of drug side effects. It recognizes the unexpected, which is where discovery begins. It's often thought-provoking and best used to stimulate performance of more powerful studies. However, such diseases are prone to overinterpretation and should not be used to draw conclusions about cause and effect. It also cannot test for statistical association because there is no relevant comparison group as shown on this slide. An example of a published case report occurred in 1961, where there was a 40-year-old woman who developed pulmonary embolism after beginning use of oral contraceptive. An example of a case series is when in Los Angeles, 5 young homosexual men were previously healthy. They were then diagnosed with pneumocystis carinii pneumonia in a 6-month period from 1980 to 1981. This may herald an epidemic. Cross-sectional studies is when a population is surveyed at a single point in time. This is like taking a knife and slicing it through a piece of cake. It describes the relationship between exposure and disease. However, it is difficult to determine or verify the temporal sequence of cause and effect. This is an example of a cross-sectional study. The prevalence of stroke is assessed in smokers and non-smokers, and results are then compared. Analytical observational studies are performed in a population or groups of people in the region rather than the individual person. It relates the frequency of the exposure factor, for example, fluoride level with the outcome, dental caries, in the same geographic area. and are useful for generating hypotheses. However, again, such studies cannot establish temporal sequence between risk factor and disease, as it cannot draw causal conclusions. It is simple to conduct, but very difficult to interpret. Let's move on to cohort studies. Cohort studies can either be performed prospectively, which means forward in time, or retrospectively, which means backward in time. A prospective cohort study is when a group of subjects are followed over time. In this example, both the exposed, which are the smokers, and the non-exposed population, the non-smokers, are identified. The rates of disease occurrence, which is lung cancer, in the two groups are measured as shown on the slide. A case control study, however, is a retrospective cohort study. The researcher identifies a cohort that has been naturally assembled in the past. Example, patients with and without lung cancer. Collect data on their exposure history and compares the data between the two groups. The last type of epidemiological study is the experimental study. Experimental studies are randomized controlled trials. This is when the investigator actively attempts to change a disease determinant or exposure or behavior or progress of a disease through treatment or intervention. The investigator controls the study population by specifying the inclusion and exclusion criteria of the study subjects. Study subjects are then randomly allocated into two groups: the treatment group, which receives the treatment under the study, and the control group, which receives standard treatment. Sometimes the investigator will use placebos to mask what treatment has been given. Results are then compared. A randomized controlled trial is used to evaluate the effectiveness of different therapies. Blinding occurs when assessment of outcomes are performed by those unaware of the treatment group. Both subject and researchers do not know whether the subject is in the control or treatment group, as placebos are given. Double-blind randomized controlled trials are the most rigorous clinical research study designs. And these study designs are frequently used in phase 3 clinical trials to assess the effectiveness of a new drug against standard therapy. So how do you decide which study method to use? You need to link the study design to the research question. For example, for prevalence studies, cross-sectional studies are the best. For causes of risk factors, case control, cross-sectional studies or cohort studies are the best. To determine prognosis, cohort studies are the best. To determine the experience of an illness, qualitative studies are the best. This type of study design will be explained more in week 4, where the qualitative study module will be shown. However, if you want to determine the effectiveness or harm of a treatment or an intervention, randomized controlled studies are the best. This is also another useful slide that links the study design to the research question. To implement activities, surveillance studies, meta-analysis or systematic reviews provide the best evidence. Some research questions can be answered by more than one type of study design. The study design which you choose will depend on the objective of the study, the time you have to complete the study, the cost required, and the availability of data. Each study design will provide different levels of evidence. Analysis provide the highest level of evidence, followed by a randomized controlled trial. But quantitative study designs doesn't tell anything about the person. The last few slides show the summary of all the study designs. Determining the study design. Directions of the 3 study designs. And finally, this slide shows the comparison of all the study designs.